lot of us rely on technology to stay fit and healthy. Wearable devices make it possible to track your heart rate, blood pressure, glucose levels, sleep patterns, or menstrual cycles. You can go online to learn more about medical issues and your mental health. Price comparison websites can deliver significant savings on costly prescription drugs. These digital resources may seem to provide confidential help, but in most cases, their parent companies are allowed to save, share, and sell the highly personal information they collect about you. I'm Herb Weisbaum, the Consumer Man, a contributing editor at checkbook.org.
Welcome to Consumerpedia at checkbook.org. We're the nonprofit that helps consumers select services, avoid trouble, and save money. Because we don't accept any advertising or take money from any business we recommend, you can rely on checkbook.org to be completely independent and objective. Now, here's the host of Consumerpedia, America's consumer expert, the Consumer Man, Herb Weisbaum.
You may have heard about the Health Insurance Portability and Accountability Act, often referred to as HIPAA. It prohibits medical providers such as doctors, dentists, medical health professionals, clinics, pharmacies, or nursing homes, and health insurance plans, including government programs such as Medicare and Medicaid, from sharing health information without the patient's authorization. But unlike doctors or other medical professionals, most health apps, websites, and device makers are not required to keep your health information confidential. In this episode, How to Protect Your Sensitive Medical Information, we have two privacy experts joining us. Pam Dixon, Executive Director of the World Privacy Forum based in Portland, Oregon.
Hey, Herb.
And Jen Coltwriter, a privacy researcher at the Mozilla Foundation, the nonprofit behind the Firefox browser.
Hey, Herb.
So let's start with this. I think a lot of people assume that when it comes to medical information, anything you disclose is private, but that's far from the case. Pam, why don't you explain what protections we have under the federal privacy law called HIPAA?
HIPAA is, as you said, it's a federal statute. It protects the information that's flowing in the healthcare ecosystem. This is a really important thing to consider because if information is in the official, formally regulated ecosystem like a healthcare provider, a physician, a pharmacist, etc., then that information is in fact covered under HIPAA. But the minute you have healthcare information that is outside of that system, for example, let's say you take a copy of your records and you email them to someone that is not a doctor, those records no longer have that same protection. If your records are with a healthcare provider, then there's coverage. If your records are outside of that system, they no longer have the coverage. So the very same information that would be protected in the hands of a doctor is not protected in the hands, for example, of a commercial company. This is a very broad brush treatment of that, but that's about the approximation of how it works.
So Pam, let's talk about things that many of us do, and you tell us if they're covered by HIPAA. Data collected from searches done on your phone or web browser.
No.
Information you provide to a website or app not affiliated with your medical provider.
If it's not affiliated with any medical provider, no.
Health data generated by smartphones and smartwatches, the wearable tech we all have, internet-connected medical devices, unless that technology is provided by an entity covered by HIPAA for treatment purposes.
It's all out unless there's a very exceptional circumstance that it's completely covered under HIPAA.
So a lot of the routine things that people do as far as collecting health data are not covered by the federal privacy protection, and I got a feeling they may not know that.
I think that is the number one problem that we're having in health privacy today in the U.S.
So what's the harm in having so many companies collecting this data? After all, it's just a smartwatch keeping track of my heart rate or a medical website that knows that I search for ovulation or erectile dysfunction. What's the big deal?
There are a lot of big deals currently in our current environment. So let's say that, and these are real cases, by the way. So let's say that you are a young woman and you've been suffering from anorexia and you go online and discuss this with your friends on social media. You could be denied an insurance claim for healthcare treatment based on this, even though you didn't do it within a healthcare setting. But that information about you and about your condition is considered to be fair game because it's out in quote unquote the wild. It's unregulated. So your healthcare information, when it's outside of the HIPAA protections, does not have all of the legal and privacy protections that your ordinary healthcare information would. That's the big risk. So if you are discussing, for example, a genetically linked disease like Hodgkin's disease, or just a variety of other, diseases that are terrifying and scary, this could have an impact on what insurance companies think about your progeny, about your children, your relatives. So we have to be really cautious about the information we post about ourselves to the wide world. But also, we need to think about how that will affect the people who are related to us. Because once the information is out, it's out there. And I think we all know now that there's no getting it back. And it's even more true today than it was in the past.
So just to be clear, if I see a doctor about depression, that visit is covered by HIPAA privacy rules. The physician, the staff, your insurer, they can't share the information about the condition or treatment with anyone else outside the HIPAA system. But if I search online for information about depression or download a discount coupon from a drug website that gives me a discount for the meds the doctor may have prescribed to treat that condition, HIPAA does not apply and that information can be sold or shared. Did I get that right?
You've got that right. Now, there are always little caveats and use cases that are different. But if you're online and you're downloading a coupon just from the web and it's not from a healthcare provider specifically, it's really problematic because you're basically giving your health information to a third party that's not covered under HIPAA. And it's really challenging to tell what entity is covered under HIPAA and what isn't, especially when those entities are running around saying things like, we're HIPAA compliant. We have this trust mark here that looks like a HIPAA seal. So you've got to really ask the company in writing, are you regulated under HIPAA? Not are you compliant with HIPAA, but are you a regulated entity under HIPAA? And that's a yes or no question. There's no in between there.
To find out what's being shared by non-medical providers with access to your private information and how it might be used, you'll need to read each company's privacy policy. But even if you do, you may find it deliberately vague or difficult to understand. Jen, you read privacy policies for a living as part of your job at Mozilla. What do you find?
Oh, man. I find headaches often a lot of times. I didn't set out to read privacy policies for a living. I don't think anybody does. But I fell into it. And it's actually quite interesting, believe it or not, because privacy policies aren't written for, I'm not a lawyer. They aren't written for me. They're not written for consumers. They're written by lawyers for lawyers to protect the company. So they are very hard to read, intentionally vague, long and confusing. And they do cause some headaches at times.
And a lot of times they use weasel words like may or could, that kind of thing, right?
Oh, yeah. They love vague words that say, we may do this. We may collect some biometric information on you. For example, your voice commands. And that sounds good. They may just collect my voice commands. That makes sense. But by saying may and for example, they could also collect a lot of other biometric information on you, which, when you have a lot of cameras and microphones and sensors and everything these days, gets a little scary when you're talking about, they can sense my emotions or tell if I'm drunk. And so that does raise some flags for us when we see that vague language in privacy policies.
So the bottom line here is they're collecting this personal medical data so they can use it and monetize it. Can you give us an example of how they might do this?
Yeah. So if you take, for example, one of the mental health apps that we reviewed, there's a number of them that we saw do this. You land on the page, you're like, I want to talk to a therapist. There's nobody around. This sounds like a good option. And you click the Get Started button. And immediately you're dumped into a questionnaire where they ask you some pretty sensitive questions like, are you depressed? Are you suicidal? Are you gay? Things like that. And that's before you've ever seen a privacy policy or been told how this data might be used. You're thinking, they're just learning about me to assign me a therapist, but it's not clear. And so if a company knows that you're depressed and they know your age and your gender and your depression, they can build a profile on you. Other companies can pay a lot of money to target people that are depressed for products that might not be really good for them. And maybe you shouldn't be targeted if they're depressed for those advertisements. So that could make their mental health worse. So that's just one example of things that could happen that are happening.
A scary example. Now, some privacy policies say the data we share does not include customer names. We de-identify the information. It's anonymous what they get. Should that make me feel any better?
It can make you feel a little bit better. De-identified or anonymized information is definitely better than personal information that is connected to your identifiers, but it's not bulletproof. It's not solid. A number of researchers have found that de-identified information is actually fairly easily re-identified, especially if location data is included, and location data is included in some way in just about everything these days, whether it's your IP address from your computer or your location from your phone or your car. And so it's not bulletproof having just a de-identified data about you out there. And the privacy policies I read, it actually gets a little scarier because almost all the privacy policies I read have a line that says in how they outline how they're going to use your data. And they say, oh, we'll only use your data if you give us consent. But then at the bottom, they have a line that says, we will de-identify your data and then we can pretty much use it however we want. And so that's a red flag for us.
Yeah, it should be. As part of its Privacy Not Included initiative launched in 2017, researchers at Mozilla monitored the privacy and security features provided by more than 100 popular apps and found that most of them fail to protect the information they collect. We'll talk to Jen about that next. I'm Herb Weisbaum, and this is Consumerpedia, powered by checkbook.org.
If you like what you hear, we hope you'll consider being a Consumerpedia supporter by using the link at the bottom of the show notes to make a small contribution each month. This is Consumerpedia.
Mozilla recently issued a report on mental health apps, a report that one of our guests, Jen Kaltreiter, wrote. The Mozilla team tested 32 apps and 20 of them, that's more than 60%, failed to meet the group's minimum standards. Even more troubling, 40% had privacy practices that were worse than last year. Jen, tell us about that.
Yeah, so coming out of the pandemic in 2022, we actually reviewed mental health apps because we were seeing a huge rise in them, billions of dollars being poured into it. A lot of people needed them, but we were curious about the privacy of these apps. And so we looked into them, and what we found was horrible. Of the 32 apps that we reviewed in 2022, only 3 did not earn our Privacy Not Included warning label, which was terrifying for apps that collect so much sensitive personal information about your mental health status, your gender identity, whether you're suicidal, what your OCD triggers are, what your eating disorders are, all this crazy stuff that's being collected. And then privacy policies that are like, yay, we're going to collect this data and use some of it to make money, or just trust us to secure it. And so we raised the alarm last year, and it was nice to see that other people kind of followed on that. And we saw some of the regulatory bodies start to pay more attention. And so this year we decided we'd follow up and re-review the 27 mental health apps from last year, as well as 5 new ones that our readers had asked us to review. And so this year, things looked a little bit better. We had fewer Privacy Not Included warnings assigned, and that was encouraging. Some of the changes were small. A number of products that we reviewed last year had very weak password requirements. You could log into your app that let you track your symptoms, and it just required a 11 as a password, and that's not very secure. And because we worked with some of these companies, they improved their password requirements, or they clarified that all users had the same right to delete data regardless of where they live, which is significant. And so that's good change to see, but we still saw pretty much across the board, with very few exceptions, companies collecting a large amount of personal data and then talking about how in their privacy policies, how they can use that data for targeted advertising and share that information with third parties that they could also use to target you with advertising.
So bottom line, things are a little bit better, but we still have a long way to go.
Yeah, I'd say the bottom line is things were horrible. And then when somebody pays attention and kind of raises the concern, companies are somewhat willing to make some changes and adapt, whether it's a small company that's doesn't have, a whole lot of resources that changes a password requirement, or a bigger company that gets in trouble and fined millions of dollars by the FTC. Both of those things push for change. And then when people pay attention and raise concerns and call the companies out, change does happen. And I think that was the bottom line that I saw. There's still a long way to go because we live in a data economy, and this is just the way it is. And our data is not getting any less valuable. But if we make a stink and hold companies accountable, they will work to do somewhat better. And that's something that we should aim for.
But what about the bottom line takeaway that 40% had privacy practices that were worse than last year? I mean, it sounds like we're going backwards.
Yeah. Well, out here fighting the good fight, the bottom line is it takes a lot more people to step up and really push for change. It's hard. There's just so much money in this data. And the more detailed the data is, the more valuable it becomes. Knowing somebody's depressed or knowing somebody's sexual orientation or being able to have all that information, but also combine it with information about where they live and how often they shop, these profiles that you can build on people and just really target them. There's just so much money in that. And so the bottom line is, things aren't getting better in the big picture. Our privacy is still very much in jeopardy, and we all need to do more, I think, is the bottom line, especially the policymakers and the regulators and the companies, because consumers should not ever be expected to sit around and read privacy policies all day long and constantly re-review and make sure they consented to the right things or opted out if they have to. That's just too much to ask of consumers.
So how can a privacy policy that's horrible get worse? I mean, what's worse than horrible?
Well, we saw one company that wasn't awful last year actually remove the language that made it clear that all people, regardless of what privacy laws they live under, could delete their data. And so now it said, depending on your jurisdiction, if you live under California's strong privacy law or you live under Europe's strong privacy law, you can have your data deleted because those laws require. But if you don't, we don't guarantee that right. And so that's something that we saw going backwards. We also saw, language that just got more vague, less clarifying, things like that. Companies update their privacy policies all the time, and it's really hard to keep up.
So Mozilla found that several mental health apps, Talkspace, Happify, and BetterHelp, push consumers into taking questionnaires up front without asking for consent or showing their privacy policies first. That sounds kind of troubling.
Yeah, we found that very troubling because these questionnaires from these mental health apps, you're having mental health issues, so you're not in the best frame of mind to begin with. And you go to the website for some of these apps and you click Get Started because you're like, I need a therapist, I can't find anybody, my mental health is crap. Get started, and immediately you're launched into a survey where it asks very sensitive questions like, are you depressed? Are you suicidal? Are you anxious? Are you gay? Are you married? Things like that. And this is before you've ever been offered any sort of privacy policy, any form to consent to have this data collected. But they do collect that data on you. And that's data that they could share with advertising companies like Google or collect and use that to target you with ads. And so that's really scary and really, really, really bad privacy practice. That data should never be collected without anybody being told how it's going to be used and then being asked to give explicit consent for it to be used any other way than to provide the service, which in this case would be a therapist. And that's what they found. The FTC has fined BetterHelp almost $8 million this past year because they had lied about some of their privacy practices. According to the FTC, they lied. And so it's good to see the FTC holding companies accountable. It's really scary to see them holding them accountable because they basically misled people through their privacy policies and use very sensitive data in ways that they shouldn't have.
Your report called Replica, My AI Friend, one of the worst apps ever reviewed. What made Replica, My AI Friend so bad?
Yeah, Replica AI Friend was an app that was requested that we review from our users. And when we looked at it, we were shocked because it's an AI chatbot. Those are becoming very popular. This was one that's been around for a little while. And it was one that was designed kind of almost as a friend, a girlfriend. A lot of people were using it in kind of girlfriends and flirts and sexual situations. And so it's collecting a lot of very sensitive information. And it earned all of our privacy dings that we assign, as well as we had serious concerns about how the AI was used. People didn't have any control or transparency into how the AI was used. And they were creating these kind of girlfriends, and then Replica AI changed the AI, and suddenly they weren't their girlfriend anymore and people were freaking out. And so it's very kind of unique and interesting example of a company really bad at privacy, but it was also the way of the future with these chatbots and people forming relationships with them, but not having any control over the company changing the algorithm next day. And your friend now is an enemy, and that's really hard on your mental health.
So, how do you protect yourself and your personal health information when you go online, use medical apps or smart devices? It isn't easy. We'll talk to Pam and Jen about that next. I'm Herb Weisbaum, and this is Consumerpedia, powered by checkbook.org.
Consumerpedia Fast Facts. The global market for big data continues to grow by 14% every year. In 2020, it was valued at $56 billion, with nearly half of that coming from healthcare data. When asked, 97% of U.S. corporate executives said their companies plan to invest in big data and artificial intelligence. It's estimated that every person on Earth generates 1.7 megabytes of data every second.
So, we know the problem. Too much health data is being collected and shared, whether users realize it or not. Jen, how can we use the privacy policy when these things are designed by lawyers to protect the company and nearly impossible to understand? What can we do staring at this thing that goes on forever and ever and ever and ever?
Yeah, well, let me give you a couple of tips that somebody that reads privacy policies for a living does. First thing I do when I start to review an app is I actually go to the Google Play Store. I ignore the data safety information because I don't trust that. It's self-reported by the companies. Google doesn't do a great job policing it. So I don't trust that. But I do click on About the App, and then I go down, and in that section, there's a thing that says Permissions. And I click on that link, and it tells me what permissions the app will request. So is it going to use my camera? Is it going to ask to use my microphone, track my location? And if I'm, doing an app that's going to give me recipes and it doesn't need use to my camera but requests it, that's going to be a red flag. If I'm downloading an app to listen to songs and tell me what the name of the song is and it requests access to my microphone, I'm like, that's okay. That's one of the first things I do. The second thing I do when I go to a privacy policy is I actually look for the California privacy section. And it's down at the bottom. Not all privacy policies have them, but because California has a really strong privacy law, companies are required to give more information to people in California. And so I go look at that and read that first because it's usually easier to read. It lays things out more clearly. There's less vague language. It's usually more shocking in telling you this is the data we collect. This is how we use it. You'll see the word sell in there a lot. California has a definition of selling data that a lot of companies dispute, but they are still required to report it. So I start there. I also use my control function on my computer a lot and look for words like sell, combine, data broker, delete. I just kind of look for the things that are important to me. What information is it collecting on me? Do I have any control over it? There's sections for this. And can I delete it? And you can kind of just glance through those, especially the California privacy section, and get a feeling of whether something feels okay or whether something raises a lot of red flags in a couple of minutes.
Pam, many patients ask their physicians to recommend apps or wearable devices, and that's good. Can you assume your medical provider knows the data collection policies of the technology they're suggesting to you?
It depends on the provider. Some providers are very up on this, but some aren't. So it's really good to have that conversation right in the office when you're having that discussion.
But don't assume just because my doc suggested this or provided this that it's HIPAA compliant.
That's correct. This is a very complex area, and it's really difficult. In order for us to determine if an entity is covered under HIPAA or not, the surest way that we've found to ensure we have the right answer is to simply ask them. And if you use the term, are you regulated under HIPAA? That should elicit the proper answer. They should say yes or no to that. So sometimes companies will say, we're HIPAA compliant. And if you say HIPAA regulated, they will understand what you're asking. You are asking for, are you regulated under this actual law or not? But other than that, it's a very confusing area, and doctors can be confused too.
An important point, and I don't want this to get missed, just because I download the app from Google or the Apple app stores does not mean my privacy is protected, correct?
Correct. Yes. They have some protections in place to try and weed out apps that are malicious or privacy disrespecting, but they're not foolproof. There's a lot of concerns around the apps. And, if you go and download TikTok's been in the news a lot for privacy concerns. If you go into the Google Play Store and look at TikTok, it claims in their data safety information that they don't share any data with third parties, and that's just false. But you also just never know when you're going to download an app that's malware or suspicious. And so do a little bit of research, make sure you're downloading a credible app from a credible company. I mean, one thing I do is just look for a privacy policy. Privacy policies should be on every app page in the app stores. If you can't find a privacy policy, do not download the app.
Jen Coltrider runs the Privacy Not Included research project at the Mozilla Foundation. It works to improve privacy for everyone. Jen, thank you for sharing what you learned with us.
Yeah, thanks for having me.
Pam, I guess the best advice is be skeptical and watch what you share?
I think that's the very best general rule of thumb advice. The second piece of advice I would have is this. If you're considering, sharing your health information, your detailed health record with a website or an app, you need to be really certain that that website or app is actually regulated under HIPAA. If it's not, you are giving your health information to an entity that does not have the legal requirements to protect your privacy in the same way that HIPAA does. There's a lot of protections for patients in HIPAA, and it's worth getting them. So, for example, if you have the option to get counseling and it's online, make sure that all of the information that you're putting online, from your name to your demographic information, like your phone number and your email, all of it, make sure that they're not selling it or monetizing it, because it's connected with a counseling session. So you want everything from A to Z to be covered. And the best way of doing this is to write to the company through their email, through their privacy policy, whatever contact information they have there, and ask for their policy in writing and whether or not they are a fully regulated entity under HIPAA. The answer to this is yes or no. If the answer is no, really seriously consider not going there or sharing your information, because it really becomes a free-for-all. It's a difficult choice to make, and I understand there's a convenience, but it's super important to find actual healthcare entities who are trying to help you, who are working online, and they do exist.
Final point. While the FTC is using lawsuits to let the industry know it won't stand for misleading people about sharing their medical information, that can only go so far. Pam, I know you would like to see some strict regulations to control the marketplace.
I would. I do think that we need to have a lot of oversight over what I call HIPAA adjacent information. Really, we're in such a digital era now. The outside of HIPAA health data is overwhelming the inside of HIPAA health data. So I do think that we need to think about how we can be protecting this data. I do think that ensuring that people are being very clear about whether they're covered under HIPAA or not is a really good start. And then after that, being very clear about whether or not, or if they will in the future, share or sell your health data to other parties for any use whatsoever.
Pam Dixon is Executive Director of the World Privacy Forum. You can find her online at worldprivacyforum.org. Pam, thanks for sharing your expertise with us.
Thank you. What a pleasure.
You can read more about health data privacy by clicking the link in the show notes. And with that, we come to the end of another episode of Consumerpedia. Remember, we post new episodes every other Thursday. You can help us by rating this episode. And if you haven't done so already, follow us on Apple Podcasts, Spotify, or wherever you listen to your podcasts. Another way you can support this show is to follow us, Consumerpedia on Facebook and Instagram, and at My Consumerpedia on Twitter. I'm Herb Weisbaum. Thanks for listening.
Consumerpedia is a public service of checkbook.org. We're a unique nonprofit that helps you save money and make smarter choices. You can count on Checkbook to help you find the best services and avoid the worst, with local ratings that are accurate and unbiased. If you live in or around these 7 cities and haven't joined Checkbook yet, check us out. Boston, Chicago, Philadelphia, Seattle, San Francisco, Minneapolis-St. Paul, and Washington, D.C. To get your free 30-day subscription, go to checkbook.org/Consumerpedia. If you like what you've heard, we hope you'll become a supporter by using the link at the bottom of the show notes to make a small contribution each month. Consumerpedia, empowering consumers to save money and make smarter choices.